welcome back to another NHS Wellness Podcast. And today we have Dr. Jack Myers and we have Kaylin Dodson, who works in surgery. And we're going to talk about sugar addiction, carbohydrate addiction. It's the same thing. And we're also going to talk about mental health. We're really going to hit that hard and how she is healing her body through her diet, healing the mental health aspect of it through her diet. So Kaylin, let's talk about why we initially what was going on with you that we made an appointment with Dr. Myers.
So after I had children, I had some postpartum issues and I was put on Lexapro and I had to up that dosage I think 4 times, and then I was put on Wellbutrin as well and I had to up that 4 times as well, and I was coming up on having to up that medicine again, and I didn't want to. I wanted to be medicine free, and so I was talking to Sean, and she told me about Dr. Myers, and he was telling me that the carnivore diet could help because of all the inflammation in my brain, and so that's what originally got me started, is I wanted to come off of my medicine and not be a mad mom anymore.
So what was it like?
Like the carnivore diet, or?
Let's talk about it all. We're going to be I want you to be completely raw.
Okay. Sorry. So starting the carnivore diet, I was pretty skeptical because I didn't see how that could hit so much on my mental health. But whenever I started the carnivore diet, it was really hard coming off of all the carbs and just being on a strict carnivore diet. It was really challenging. I have a really big sweet tooth. But I started noticing a big difference within the first, I think, 3 weeks. My cravings kind of subsided and I wasn't tired all the time anymore. I had a little bit more patience at home, and then I came off of all of my Wellbutrin actually, and it was a huge change. I had comments from my husband saying I'm much more patient at home. I noticed it with my daughters. It was a complete shift change. I wasn't tired nearly as often. I didn't need naps during the day. And then I'm just recently coming off of my Lexapro, and so far that's going well too.
So why did the carnivore diet help her mentally?
Well, so I'm still figuring this out myself. Mm-hmm. I'm not a healthcare provider. I'm not a mental health care provider. But I was sick. And I didn't know what my problem was, but I had severe insulin resistance and probably prediabetes and metabolic syndrome for sure, high blood pressure and morbidly obese, but I had a whole bunch of problems. I had asthma, I had arthritis, I had sleep apnea, I had high blood pressure, I had problems with the veins in my legs, venous insufficiency, allergies, arthritis, gingivitis, skin problems, and just trying to get weight off. I got rid of carbohydrates because I knew that worked, and I didn't want to yo-yo. I said, I don't know what this is going to do to me, but I'm never going to eat carbs again. And I don't know if it's healthy or not, but I'm just done with that. And I was starting to get better, but it wasn't just that I was losing weight. All of these problems were going away.
Right.
My arthritis was going away. My asthma was going away. And that didn't make a lot of sense to me. And that's when I really started diving into this. And then I found Ben Bickman, who really put it together for me. And his book, Why We Get Sick, explains how hyperinsulinemia and insulin resistance is the root cause for just about everything that we're dealing with chronic health-wise. And certainly that was the case for me. And now I understood it. And then I found Dr. Ken Berry, and that's where the proper human diet element came in. And actually, this is how I was supposed to be eating my whole life, is basically a high-fat, minimal carb diet, which for me is carnivore. That's not for everyone, though I use it a lot in my patients. Here's the reason I would suggest to do carnivore. First of all, let's get you into a state of ketosis. If you're eating the standard American diet, you're not generating ketones. Your brain preferentially burns ketones. And so there's just dramatic improvement people report just by being in ketosis. But let's get the inflammation out too with this. But the big thing that I like carnivore for, and I think that everybody should try a 90-day trial of it, is to get rid of the carbohydrate addiction. and look at it as a drug addiction, and the most lethal drug addiction, because that's what it is. So if you can go 90 days, absolutely no cheating, 90 days of carnivore, which is so hard to do, especially when you're first starting out. It is not easy. The first 2 weeks is hard, but if you can go 90 days, you are such a different person at the end of that 90 days that you can declare yourself free of that carbohydrate addiction. It's not easy to do, but you're free of your carbohydrate addiction. You're feeding your brain ketones, and you've reduced your inflammation from your dietary source as low as possible in my estimation. So that's the reason I said, I don't know. I mean, this is because your labs look good. You're fit. You don't look like the typical patient that comes seeing me for help.
Right.
Is not in good health. She looks and appears to be in good health, but she's struggling, and it's mental health. And so let's try it. And I'm pretty sure it was miserable for a while till you get out of the drug withdrawal phase of it.
Absolutely.
But then once you get to 30 days, you're now really starting to feel the benefits of it. And then, like I said, if you can string 90 days together, now you're free of the carbohydrate addiction. And then you could start to go, all right, do I have to stay carnivore? Can I go keto? Can I go low carb? She probably could go anywhere in that spectrum there as long as she's feeling good. But I would, for me, I am so ancestrally pointed towards I have to live on meat and eggs, or if I stray from that, then I start to feel it. So that's just where I'm going to live the rest of my life, and I will be perfectly thrivingly healthy eating that way.
That's my diet, carnivore. What was that like for you? Let's talk. So you were a sugar carb addict.
Yes.
Complete.
Very much so.
Talk about the drawer in your kitchen. That was your sweet drawer, right?
Yes, we have a sweet drawer. Like holidays, everyone gets the girls candy, and we would dip in there here and there. I would have Reese's that I would freeze in my fridge, and I'd have 1 or 2 a day. I was eating bread, I was eating pasta, and like I counted my macros, because like Dr. Myers was saying, I am very active, so I was counting my macros to make sure I got my protein in, make sure I stayed within my levels. I think my carbs were set to around 150.
They were 150.
Yeah, so they were set to around 150. I was hitting 150 every day, probably with my sweet treats, maybe 170, 200-ish. But I stayed living in that area, and cutting it out was such a pain. It was so hard. I really struggled for about 3 weeks. And then after that 3 weeks, it was around Easter time. I was like, you know what, it's Easter. Let's just see. And so my mom made a big spread. I had, I don't know how many bread rolls. I had sugar, like I did all the things. And coming to work that Monday, I was just in a fog. I'm a scrub tech. I pass total knees, I don't know how many times a week. Like, it's routine. I know the steps. I could sit here and tell you all the steps by memory. And that day, I struggled so hard. My doctor looked at me like I was crazy. He's like, are you good? Like, what's wrong? I was like, I don't know. And after talking with Sean, I was like, I'm just in a daze. Like, nothing is, I was just so slow and behind. And I believe that, so Monday and Tuesday, starting Wednesday, I finally came out of that daze, and I started to feel myself again. And then, like, that week, my hip was, I have hip issues. Like, I don't know, after having children, my hips just hurt. And that week, my hips were hurting. They were in pain. And then once I cleaned up my diet again, I didn't have that pain anymore. So, yeah, no, it was a struggle getting on that diet. But now that I've been on it, I mean, it's so much easier now. So just the choices you make. And, like, I'm completely sugar-free. I don't eat sugar at all in my diet. And that's made a huge difference in our lives, too.
It's a lifestyle change, so
yeah.
we would definitely call it a lifestyle change.
Yeah, 100%.
Yeah.
And even now, if my husband's making dinner, he doesn't even make sides anymore. We just have our main entree, and that's it. And, like, we don't have breaded food. I think I have chicken nuggets in my house for my kids, but that's really about it. I don't buy bread anymore. Like, we're pretty strict with what we eat, and not even in a bad way. Like, this is just our new normal.
Right.
Yeah, I took pride in cooking, and I was, there's so much about me that's completely different now. But I think the big thing is embracing that food is not comfort. It's not entertainment. It's not escape. It's not, it's food is, when you're hungry, food is fuel and medicine. And that's how I look at it now. And I could eat the same thing every single day from here on out, and I'll be fine, because I only eat when I'm hungry, which is once or twice a day. I don't snack. I don't eat breakfast. I wake up, I do my work, and once I'm good and hungry, I stop what I'm doing and I eat fatty meat and eggs until I can't eat another bite. I don't count calories. I don't worry about any of that portion size, nothing. And I could do the same thing every time. It's delicious every single time. I love what I eat, and I feel great. And I'm 49 now, and I feel better today than I ever felt in my early 20s. And it's just amazing just how sick I was, and it was just from our diet.
What was like a typical day prior to carnivore, ketovore for you? What was it like? I know you got to take your medicine, but what was it like mentally?
So it kind of started the night before, depending on when I got the girls to bed. That would determine how tired I was the next morning. Waking up was always hard. Like this morning we woke up at 7 and I was able to just get out of bed. Before I'd be like, okay, I'll turn on a show. I'd open a snack for him and I'd go back to sleep. Or I'd be laying in bed. It was always hard to get out of bed. Once we got out of bed, it took me 30, 45 minutes to actually wake up and be ready to be a mom. So that was always a struggle, and then I would just always feel so tired. That's one thing that my husband has really pointed out. He's like, you're a sleeping zombie. Like, you're just tired all the time. And I couldn't help it. It doesn't matter how much sleep I got, how long I was sleeping for. I was just always constantly tired, and it was an effort to do things. I didn't want to play with my kids. That sounds awful, but I just didn't have the energy. I didn't have the patience for it. And so that was just our day-to-day. It was just a hassle to do, like, dinner and normal things. Even doing things that I wanted to do, I was like, I'd rather take a nap. And so that's kind of where I lived, was just sleepy all the time. Not super patient, not available for them like I should have been. And then 8 o'clock rolls around and I'm putting them to bed and I'm ready to go to bed. I may have slept half the day. I'm ready to go to bed now. And that was the main thing that I really struggled with, is just being tired. I just wanted to be in bed, and then I wasn't super patient, and I would snap out at minor inconveniences. They didn't matter, but it sent me over the edge where now I'm mad having to deal with this and tired and just trying to make it through the day just to get to the end of the day so I could go back to sleep.
And now
it's completely different. Like, now I'll take naps like here and there if we have like a rough night, or like I was up extra early. But for the most part, I'm awake during the day. I'm able to read my books again. We're able to do activities. We've been outside every day this week. It's just so much easier. It's not a hassle to go through the day. I'm not looking forward to laying my head down at night again. Like, I can actually enjoy my day again.
And you didn't cold turkey your medicine.
No, I was scared.
Yeah. Let's talk about that you just didn't come off your medicine.
No. So the trigger for me getting on medicine, my first pregnancy after postpartum was more anxiety, and I didn't catch it. My husband's like, yeah, I knew you had something going on, but you didn't voice it. So I just kind of let you deal with it. I was there for you if like you needed anything, and we had talked about it a little bit. And then the second pregnancy, the postpartum hit so much different. It wasn't necessarily anxiety or like depression. I wasn't sad. I was just mad all the time. I mean, anything inconvenience, I was yelling, I was ticked off, I was starting arguments, I was exploding for no reason. I heard voices like yelling at my children, like I thought someone was in the house, or I had images of them, something happening. And then the final straw was like I was awake. I wasn't I couldn't lay down at night and go to sleep. I was up half the night, but I was always tired, but I couldn't sleep. I wasn't eating. I didn't want anyone around the girls. Like, I didn't trust anyone to be around the girls. I didn't trust anyone to watch them how I could watch them, but then I didn't want to be around them. I didn't want connections outside of my home. I didn't want to do anything there. I was just so mad all the time. it's weird looking back now because the signs were so clear, but I didn't realize it until after I got on medicine. So my aunt was actually the one I was talking to her about. I was like, I know you had some postpartum and like you're on medicine. What was like the sign for you? Like, I'm not sad, I'm not crying, like I'm just mad. She's like, babe, that is postpartum. Like, talk to your doctor, get on some medicine. And so that's what started it. Is I got on the medicine and I was able to sleep that night, and those visions I was having so detailed of them went away. I was like, oh, okay, this is great. Like, I can sleep, I'm eating again, I'm better. And then it slowly started to creep back in, and that's how we started upping the medicine. And then I hit the max dose of my Lexapro, and I was talking to my PCP. She's like, well, let's try the Lexapro and Wellbutrin combo. A lot of people like that, and so I did. And then we had to up it again, and that's kind of where I ended up talking to Dr. Myers, is I don't want to up it again. Like, I just want my life back. I just want to be a good, happy mom again. Yeah,
and I definitely didn't want to interject on what medicine she should take or how to come off, because that is not my scope.
Right.
But that was where I came in, was let's try to treat the inflammation if you have it. Let's try to treat the carbohydrate addiction. Let's try to treat the lack of ketones to your brain. And that's my contribution to it. And if you want to get off your medicine, now you're gonna first of all, I would highly suggest that that's not something you cold turkey, that's got to be tapered down slowly and with somebody who knows what they're talking about with that, which is not me.
Yeah, I was talking with a nurse practitioner, and she knew my goal of coming off of the medicine, and she knew I was talking with Dr. Myers and with you, and so she instructed me. She's like, you can cut off your Wellbutrin today. I was like, no, thank you. So I cut it in half, and then I gave it 2 weeks, and then I cut off the Wellbutrin completely, and I stayed on Lexapro for a while because I was so scared and nervous, because I wasn't necessarily a danger to my children, but I was not in a safe place where I wouldn't have trusted my children with a person in my mental state at that time. So for that reason, I was really nervous about coming off of it, and I think I'm on day 3 of no Lexapro. I just started it this week by accident, actually. I forgot to take it, and I was like, oh, I feel fine, so I just continued that on. So if things kind of start to switch, I'll figure something else out. But as of right now, as of today, I'm Lexapro free, all medicine free. And that's to Dr. Myers, to you, to Juliet, for all of the support system, that I'm able to do that now.
Oh, you did it. We're just resources. You did it. You had to suck it up and get off the junk. Which was miserable.
It was for
me.
Miserable. Yeah, for you too. I was messaging you several times a day.
She had to experience that with me too, and I was in car withdrawal, and we didn't know what the heck was going on, because I was just sending it, and so.
Yeah, it probably wasn't a great time for you.
No, I refused. But no, I am so glad. I mean, on both of your behalfs, that you're everything, like your demeanors, everything about you has changed. You're not recluse anymore, and you're just. I mean, it's amazing. If you could see how you were prior to, you were recluse, and I get texts from people when you started healing, and they're like, oh my God, Dr. Myers he waved at me. I am not kidding. And you get these questions, is he on a GLP? Is he? And I was like, no, he's not. He's doing it the old-fashioned way.
I just didn't know what I was doing when I first started. Right. Thankfully now I think I have this all figured out, but it's taken me a while to do it. But it has completely changed who I am personally, who I am as a doctor. My practice it's so crazy. My practice is so much different now, and it's everybody there is getting. We're talking about when we're talking about their medical history and their surgical history and why they're here. My very next question is, tell me about what you eat.
Yeah.
And they're like, oh, no one's ever asked me that. And so I kind of eat everything on the standard American diet, and everyone's like, yeah, and I'm like, And then I pull out my phone and I show them my picture of me sick. And that immediately just grabs everybody's attention. I mean, without fail, they're just like, oh, wow.
It's a giant change.
Yeah. And so I go, this was me. And I'm just mea culpa. I was the poster child for what's wrong in healthcare. I was sick and dying of hyperinsulinemia, and I was completely unaware of it. I thought my problem was that I was obese, which I was, but I thought my obesity was because I didn't have time to go to the gym, that I ate more than I moved. I thought it was a calorie problem, it was a willpower problem, it's a thermodynamic issue, it's whatever. It is none of that. It is, I am just running on the wrong fuel. Put the right fuel in the motor, it runs right. Put the wrong fuel in the motor, it blows up and breaks down. There's other warning signs. I call them check engine light. You know, expanding waistline. If your waist to height ratio is greater than 0.5, that's a check engine light. If your blood pressure is high, that's a check engine light. If you're depressed, if you're anxious, if you're in pain, if you have arthritis, if you have asthma, I mean, these are all different check engine lights. Let's stop disabling the check engine light. Let's fix the problem.
Yes.
And almost all of that is because your insulin's too high. And your insulin's too high because of our standard American diet.
Right.
And there's other ways to bring it down. But you got to bring your insulin down, you've got to bring your inflammation down. For me, that's eating meat and eggs. You could do fasting. You could probably do a plant-based approach, I don't know, but not for me. Okay, but whatever you do that brings your insulin down to a normal range and then brings your levels of inflammation down, it's the chronic hyperinsulinemia and the chronic inappropriate inflammation that's making everybody sick.
That's exactly right. And it's not, the proper human diet is not just about our physical appearance or things like that. Look at, it helps with the mental health also. And
Well, if you're
been talking.
if your body's sick, your brain's sick. So that's that. And I think that's where it's tied in. You know, if you're dealing with some kind of issue, if you're inflamed somewhere, if you're having other organ problems, your brain is not spared of whatever that process is. But almost always, that's if you boil it down to one root cause, it's the food that we're eating.
Exactly. And there's no side effects, no negative side effects to changing your diet. Have you had, other than being mad at me first?
No. It's hard sometimes whenever like you go out to eat, you know, it comes with two different sides. At this point now, I just give my sides to my husband, or I order the sides for my kids. But I mean, once you get to that point and you know what you're doing and you're set in the ways of how you're going to eat, it's so much easier. It just takes that time.
I also find that I eat pretty much the same thing every day anyway, and I love my barbecue place, and there's an awesome plate there that he named it after me, but I can go anywhere and I can eat this way. You just have to, it just takes a little bit of effort, but I can go through Brahms and I get breakfast if I do get breakfast, which is not very often, but if I'm hungry, I'll stop at Brahms and get breakfast, and I get 4 sausage, egg, and cheese muffins. Delete the muffins. Well, they stack sausage, egg, and cheese patties in a little box, and then I'm full all day long on that, you know. But I could go to Whataburger, I could go to Brahms for lunch, or I could go to anywhere. I can get ground beef, you know. Just bring me burger patties. Can you tack me 2 or 3 burger patties and put a piece of cheese in there, you know? And I can do that. I can get steak at, you know, or beef and chicken or whatever at the Mexican place, and you know, I can eat that way at Love's. You know, I can go to Love's and they've got the fatty beef sticks, and they've got boiled eggs, and there's usually, you know, Casey's has these little egg bites in cups, and so I think that's starting to gain some traction even. But I can eat this way no matter where I go, and I can also eat this way on a shoestring, because I can eat Spam and eggs and bacon and bologna and hot dogs from Dollar General, and if that's all I had access to, I'd be perfectly healthy.
Right.
I know one cheat that helped me a lot, especially like eating out. One thing, it's ChatGPT. I just type in where I want to go. I was like, I need a ketovore or carnivore order for this, and it will give you the entire list of everything.
I never
It's
thought
so
of that.
fast. Chat GPT has, I mean, anytime I go out to dinner, I look that up before we even leave the house. I was like, okay, I'm going to order this, and it tells you exactly how to order, what you can have on the side. You can stray if you want, and this will be more ketovore versus carnivore. These are the sauces you can have. I do it all the time.
Man, that's cool. I never
Yeah.
thought of that.
Yeah, that's what I've been using for this diet. It's helped a lot. It does my meal plan for the week too. Like, it's super helpful.
That's awesome.
I might have to start doing that. My meal plan is make it to Wednesday and my barbecue place is open.
Yeah.
Yeah, no. So for at home, I plan our breakfast. We have pretty much the same thing every day. We have eggs and bacon or eggs and sausage, and then for lunch, I normally have leftovers. But for dinner, we make our meal plan for the entire week. And if I'm out of ideas, ChatGPT saves me. Or if we go out to dinner, like I said, I just type in where we're going. Even like a mom and pop's restaurant, ChatGPT has access to that, and it's been a savior for me. It's made it a lot easier.
I have a little emergency snack item that if I just, like if it's late, because I do not want to be snacking, but if I'm just like, oh man, I would normally be snacking something here. I have it sit in the freezer, but I'll take and I'll burn 3 sticks of butter, melt them down melt it down until it turns brown, and I just pour that in a Pyrex, put it in the freezer, and now I can just go and break out a little hunk of that, and it tastes great. But then instantly, that snacky
Sweet
feeling's
treat.
gone, and that thing will last me a month because it's sitting in the freezer, and I just every once in a blue moon I might nibble on it. Margarine though, but
No, it has to be butter.
butter.
It has to be butter. I put bacon bits in mine too, in my
That's
little
next
brown
level.
butter.
Yeah.
That's bomb.
I have to try that.
It is just,
The bacon doesn't ever survive around me to make it to bacon bits. Maybe I should do that.
Yeah, you just put some bacon bits. When you pour them down, then you throw your bacon bits on top. Then when it freezes, that is like candy. It's so good.
Awesome.
Yeah. So, anything else you'd like to tell our viewers today?
It's hard, but if you can make it, I mean, I'm a different person than I was 6 months ago, and I'm medicine free. I'm a good mom again. I feel so much better.
Man, that's awesome.
Yeah.
Like, so much better.
It's a complete win.
Yeah.
She's a dream now to be around.
Well, congratulations.
I love her.
I know, it's just amazing. I'm so happy for you.
Thank you.
So congratulations.
Yeah. You were my last resort, because I even starting on this, whenever I was thinking about coming off my medicines, I got a therapist. I was like, this is my goal. This is what I want to do. I have you here for if it doesn't work and if I'm struggling. And she was even like, okay, well, let's look at X, Y, and Z. And she's like, if this is working, why are we changing it? And I was like, I want to be medicine free. And so after talking with Sean and Juliet, they're like, let's just see. Let's just see. And it did. It changed my life completely. So.
And we have the Proper Human Diet group, the support group, that it meets on the first Tuesday of every month at 6:30. You'll hear from this one. And it's our HR department, and it's open to everyone. And any questions that you have or whatever, you want to be there. We'll see you next time.